5:14 on your Wednesday, and happening today, we expect to learn more about how Connecticut plans to bring down health care costs for people who are covered through the Affordable Care Act.
This impacts you if you're one of the thousands of people insured through Access Health CT. At the end of the last year, the governor announced nearly $120 million in state funding to help offset recent federal funding cuts.
Your reporter Sierra Jordan joins us live in Hartford with what this means for thousands of families who may see their health care costs go up.
Good morning. We are just hours away from that update here at the state capitol. Governor Lamont says helping to offset the cost of losing federal tax benefits could impact more than 150,000 Connecticut residents, especially those who are struggling to meet ends meet. ACA subsidies expired at the end of 2025, putting 22 million Americans at risk of seeing their monthly health insurance premiums go up. For families already struggling to get by, state leaders say that could mean losing access to critical services. Within the last few months, the governor and lawmakers created a $500 million emergency fund. Now, Governor Lamont wants to use part of that money to help people who are losing important benefits. That's why he's asking lawmakers to tap into a special emergency reserve fund, pulling $164 million to help cover the cost of food pantries and homeless services. The funding would also help subsidize health care benefits for people losing enhanced tax credits under the Affordable Care Act. The governor's news conference is scheduled to begin at noon here at the Capitol. We'll be there and we'll bring you the latest. Your reporter live in Hartford, Sierra Jordan, Channel 3 Eyewitness News. Back to you.
All right, Sierra, thank you.